Hi, I'm Dr. Michael Wolfeld. I am a board certified plastic surgeon, also board certified in hair restoration, practicing in New York City. And today we're going to talk about the ARTAS robotic system, the strategic, the economic, and the clinical reasons to add robotic hair restoration to your practice. So 20 years ago, robotics in medicine was really just a dream. But today we see it in all facets of medicine and in different specialties and surgical specialties and prostate surgery, abdominal surgery, spine surgery. So it's really advanced. And in hair restoration, we have the ARTAS robotic system, which is the only robot for the aesthetic market. And it's the only robot that physicians can actually have in their office setting. So it's really an amazing technology. So once again, robotics and medicine, there's over 70 companies that are developing robotic technology to be used in medical intervention. It's a reality. Thousands of patients and providers are benefiting from robotic technology. It creates an incredible business opportunity for physicians to be early adopters, to be innovators, to really advance the technology. And that's what's been going on with the ARTAS robotic system. I've had an ARTAS robot since 2013, and we have helped to advance the technology and to where we are today. And it's really an amazing technology. And this diagram just shows you in all different aspects of medicine. There's Intuitive Surgical that makes the Da Vinci robot. There's Mazor that makes a spine robot. There's Stryker for orthopedics. There's many examples in different surgical specialties of robotics. And once again, the ARTAS system is really an amazing technology for the hair market and just for the aesthetic space in general. Hair restoration is one of the fastest growing markets and most lucrative markets in aesthetic medicine. This graph shows a significant increase over the last decade, as well as the expectation of more than 700% growth in the next 5 years. And a lot of this is attributable to technological advancements that has made hair transplant more efficient, more accessible, safer, and robotic technology is really leading the way to be able to do this procedure, because this procedure lends itself to robotic technology based on how we do it. And that I'll get into a little bit more as we move along. So this diagram is showing the differences between FUE, which stands for follicular unit extraction, or now it's called excision, which is what the robot does. And that's removing the follicular unit grafts, which are small groupings of hair, from the back and sides of the scalp individually, one by one. So it's selecting it, it's removing it, and you're left with a little dot scar in the back of your scalp where it's removed from. And that's compared to an FUT, which is the traditional way of doing a hair transplant, which is the strip method, where you're left with a linear scar along the back and sides of your scalp. And you could see that 10 years ago, it was predominantly strip FUT surgery. A minority of providers were performing FUE procedures, but that's really been gaining a lot more in popularity over the last several years, where the FUE is actually more popular than the traditional FUT strip procedure now. And especially in my practice, patients come in, they not only they ask for FUE, but they're asking for the robotic technology. They know about it and they really seek it out, because at the end of the day, people are smart and they're going to seek out the best technology for their needs. And that's what this is. This diagram is showing that the robotic technology, the ARTAS system, is all over the world. There's about 153 systems in North America, but we also have systems in Latin America, Europe, Asia. So there's about 322 worldwide, and that number is continuing to grow because, once again, worldwide people recognize the advantages of technology. So, and that's going to continue to increase. So how did the ARTAS evolve? So the company was originally founded in 2003, and the first case was 10 harvest attempts. And for those of you that are not familiar with a hair transplant, you know, a procedure can be anywhere from a couple hundred grafts to 1,000 to 2,500 or 3,000 grafts. So 10 is not many at all, and that took 8 hours. So you can imagine where they had to go, what advancements had to be made from then. 2011, first system was sold. Once again, my experience dates back to 2013. So I was one of the early adopters of the technology in 2013. 2017, the company that first brought it to market, Restoration Robotics, went public in 2017. That company then merged with Venus Concept in November of 2019. There's consistent upgrades, software and hardware upgrades. We're currently at the 10th generation of the software. There's over 200 patents, and once again, there's over 300 systems worldwide. This is just a diagram showing the first prototype in 2003 of the robotic arm and what it looked like, and to be honest, how slow it was and where they had to go, the early people that worked at the company, where they had to go from here to where we are today. And this is where we are today. And this was the evolution from 2011 to 12 to 13, which, like I said, was when I started using the ARTAS robot. In 2015, every upgrade was faster, better user experience, easier to use, such as any technology as technology advances. 2015, it was cleared for not just harvesting, but also site making. Also, ARTAS Hair Studio was developed. 2016, 17. 17 was the last version of the older, version of the robot, which was the 9X. In 2018 is when the ARTAS iX was introduced to the market, also having the technology to do implantation much faster. Totally different robot is the iX than the older version. We'll show you a picture soon. And in 2018, I purchased my iX robot, and I was one of the first to purchase it because I knew where we were, where we came from, and what the technology can offer. And I was excited to get on board. And we're gonna show you. Here we go. This is a comparison of the older versions of the robot up to the 9X compared to the iX. So obviously it's completely different, not just the aesthetics of it, but I'll get into more of the robotic arm as well. The joints and the way it works is completely different. But what's important is logistics. And the iX robot, look how much smaller the footprint is. And this is something that's not going into a big hospital operating room, but this is going to physicians' offices. And you need a reasonable footprint to fit into the office for workflow, for the physicians to be able to use it in their office. It's on wheels, it's mobile. It's just so much easier to utilize than the older versions. And it's made it, in my opinion, something that's easier for a physician to own and have and utilize in their office. Now we'll talk about some of the technology and unique features of the ARTAS iX system. So the ARTAS robot is one of the most advanced and sophisticated medical devices. It's the first of its kind in aesthetics. Like I said, there's no other robot in the aesthetic field. The ARTAS system has revolutionized the industry, and we're just really, at the tip of the iceberg here. There's so much more that this system can do and that we can develop with this. There's also what's called intuitive graft selection, intuitive harvesting, image guided recognition. It can expand on established parameters that's built in intraoperatively. And in terms of the graft selection, that's really important because that's something that just got introduced a few years ago. That's something I helped to do some research with for the current system. And what graft selection means is that the robot is able to select which grafts it's going to harvest for transplantation. It can skip over certain grafts and select different grafts. So if you don't want a one hair graft, but you want one that has 2 or 3, it can selectively choose those. So the point being is that you can optimize the harvesting and minimize the scarring. And that's something that you can't do manually. That's something that robotic technology can offer. And that's something I discuss with all my patients as well. And that's, I think, a huge advantage to what the IX can offer. So how does the IX vision improve hair transplantation? So proper visualization of the position orientation of each hair is critical. It can monitor the position and orientation of all hairs in the field of view 60 times per second. That's compared to only 10 to 12 for the human eye. It has a resolution to 44 microns, which is extremely small, meaning that it really can select and read the hair, and it can really read the angle of it and go after the best grafts for harvesting. It repeatedly recognizes and identifies key features and adjusts for patient movement. And it's got better vision. It does not fatigue for more accurate harvesting and more natural looking implants. Basically, another thing is if you compare robotic FUE versus manual, if you're doing 2,000 grafts by hand, you're going to get tired. A physician is going to get tired doing it. So the 2,000th graft may not be the same quality as the first graft. There may be more transection as the fatigue level increases, but that's not the case with robotics. This robot is perfectly suited for this type of procedure, which is reproducible, accurate, and precise. Those are 3 key words, but reproducible means that the first graft is going to be the same quality as the 2,000th graft. And that's what you want. And that's what's really going to give you optimal results. This diagram just further shows a comparison of what 44 microns is compared to some other objects. It's small. That's the takeaway. It's small. Okay, so artificial intelligence, it's a word that we hear a lot. It's the ability of machines to carry out tasks in a way that we would consider smart or require intelligence, visual perception, speech recognition, teaches machines to make decisions and take actions based on these parameters. Rather than teaching computers everything they need to know about what's going on, it's how to carry out the task and to learn for themselves. And that's really what we're doing here with the robot is we're giving it the information, we're setting the parameters, and we're allowing it to learn what it needs to do to optimize this procedure. So it does have artificial intelligence. It has machine learning with algorithms that are built into the system. And this all goes into it. And I'm sure this is, these are topics that the audience would be very familiar with, but it's something that really has optimized the use of this robot. So a great advancement with this robotic technology is the robotic arm. The new KUKA robotic arm. And what I've seen in my practice is the joints. There's 7 joints compared to the old robotic arm, which had less. And there's more dexterity, it's more efficient movement. And like I said, what I've seen is previously we had to move the patient around more frequently in order for the punching mechanism to reach different points of the scalp. Because there's extra joints in the arm, the robotic arm can get to more places of the scalp. There's less patient movement, more comfort, less time for the patient, for the physician, for the procedure. So that has made a huge difference. There's also force and torque sensors in each joint. It's just a nicer, more aesthetic design, looks better. It's smaller, lighter, stronger. And it creates better collaboration with how it's working, with how the physician works, the staff that's helping is working, and whether the technicians or anyone that has to work with the robot, it collaborates better, and it makes the process much, much smoother. So these are the three key words, once again, with what the robot can do: precision, accuracy, reproducibility. The precision, the hair follicles are located under the surface of the scalp and invisible to the naked eye, and locating these follicles requires precision, and identifying the best hairs for harvesting, for transplanting. And it can read the hair, it can look at the hair 60 times per second, and before it makes the decision to harvest that follicular unit graft. And the accuracy plays into it as well. So it's harvesting with micron accuracy. So the accuracy also plays into it with the angle. So what I tell my patients also is that the angle the hair is under the skin is not the same angle when the hair exits the skin of the scalp. There's a divergence of the angle. So when the hair is under the skin versus when it exits the scalp, there's a divergence. So there's an angle there. And the robot can read that angle, and it can make a correction so it goes in at the precise angle to minimize or prevent transection of the grafts underneath the skin. So that correction is about 12 to 18 degrees. And it can do that each individual time, so it's reproducible. And that's where it comes into play about the first graft and the 2000th graft being the same quality. The human eye can't make that correction that number of times with that angle. So all these things is what, and these factors, the precision, accuracy, reproducibility, is where the robotic technology comes into play and is a great advantage. Also implantation, it can optimize harvest selection, site or implant locations with randomization and filling algorithms to produce natural looking results, right? Because that's the goal, is natural results. So one thing is the harvesting of the grafts and getting healthy grafts, which are hairs, to harvest for transplantation, minimizing wounding, minimizing scarring, and then transplanting them at the recipient site in a way that's going to look natural, that it's not going to be noticeable, and it's going to give you a great aesthetic result. So we could do that. And intraoperatively, the robot can create new map of required parameters based on locations of the scalp and remembers and adjusts these parameters. And it avoids terminal hairs. What that means is that in the recipient side, you still have hair there. It's just thin and you have some balding areas, but you still have some hairs. So when you place the new hairs, the new grafts, you want to place it around those hairs that are already there. Those are called your terminal hairs. And you don't want to place them right on top of each other because it's not good for the graft or not good for your existing hair. So the robot can read and see the terminal hair and avoid it and place it in the appropriate positions in a natural fashion. So another really important topic to discuss is safety, right? Robots can be great. They can look, amazing. They can look cool. Patients can love the technology. But if it's a medical robot, first and foremost, it needs to be safe for the patient. Whatever technology can offer, we can't do a procedure if it's not safe. And there are multiple safety parameters built into the ARTAS system that really prevent injury to the patient. The tensioner or the grid that you'll see an example of that's applied to the patient's scalp, it really secures the patient's head in place so they can't move their head. It's very limited movement. If they were to move their head during the procedure, there's built-in motion sensors that automatically pause the action of the robotic arm. The robot can also be paused at any time. There's stop buttons on the interface at the robotic terminal. So if there's any issue whatsoever, it can easily be pushed and the robot pauses and the needle mechanism retracts. There's also built-in backup generator within the robot. So if there's a power outage that happens to occur during the procedure, you have time to retract the mechanism, put it into a safe position as to not cause any injury or harm to anybody. And there's also advanced sensors within the sharp and blunt needle mechanisms that recognize the pressure, and they have on-off, basically stop switches. The needles have a built-in skin pressure sensor, which if they register pressure greater than 10 newtons, an automatic stop is triggered and the punch mechanism is retracted. So the ARTAS IX is a interactive computer-assisted system utilizing image-guided robotics to enhance the quality of hair follicle harvesting for the benefit of physicians and their patients, which is what I've been going over. The system enables minimally invasive harvesting of hair follicles in a precise, accurate, and reproducible manner. It is cleared by the FDA for its use, and the ARTAS IX, it's cleared by the FDA for men with straight dark hair in terms of the harvesting procedure. And it's indicated for patients with a diagnosis of androgenetic alopecia, which is a common genetic pattern balding. So this is a video example. The video may be moving a little bit slower, but this shows the position of the patient. The yellow is what's called the tensioner. There's computer algorithm or fiducials around the border. That's how the robotic head with the 3 built-in cameras are able to read the fiducials, orient itself to where it needs to harvest from, and undergo and perform the harvesting. The newest version, the IX robot, is able to find this tensioner on its own by just the press of a button and orient itself to begin harvesting. In the older versions of the robot, this wasn't the case. The physician had to physically pull the robotic head into position, but not anymore. And within that grid is where it's doing the harvesting, where you set your parameters. And the speed that you saw this going actually in real time is an amazing advancement and improvement over where we were in previous versions of the robot. And it's just exciting to know where we're going to be down the road, as well as technology continues to advance. This is a video just to show you the setup, and that's me in the blue scrubs sitting right next to the patient at the computer terminal. So I am controlling the parameters. I'm setting the parameters. I'm controlling everything from the computer terminal. It's physician-assisted robotic surgery. So I'm there if there's any issues. I'm next to the patient to manage it, to take care of it. But the robot is working while I'm next to the patient. So in this video, we're seeing the implantation of the grafts. So it's at the same time it's making the site, it's implanting the grafts as well. And you can see those little yellow stickers. Those are the fiducials on the patient's recipient area, and that's how the computer, that's how the robotic head, the cameras are orienting itself in order to implant the grafts, avoid the terminal hairs, going at the precise angle and the precise depth to optimize the placement of the grafts, the growth of the grafts, and the naturalness of the result, which is why we're doing this procedure. And this is a picture of the computer interface where we're doing the harvesting. So this is from one of my my procedures, one of my patients, and everything is there for us to review. And there's a lot of information here, and it's something that physician has to really familiarize themselves with, so so we can optimize the procedure. So you can see the grafts that have already been harvested in the turquoise blue shading, and then you see the graft that's about to be harvested, and then the graft that it's gonna harvest next. So you see that information, you see the angle of the hair coming out of the scalp, you see the depth, you see a picture of the last graft that was harvested. You can make adjustments on the depth of the angle, you can do all that. You see how many grafts have been harvested already, the density of the patient's scalp. So all this information is set for you here, and that's what you're monitoring as the case is going along. The ARTAS system is really designed to give a natural hairline, a natural result, a random result. I mean, when we say random, that's a good thing, right? A hairline or a transplant that is not randomized, meaning that it just looks like it's a straight line, is not what we are trying to achieve. We want a random hairline, because that's how your hair grows naturally. So that's what it's designed to do, and this is an example of the robot and having done that. And here are some examples of before and after patients. This is every patient's had this FUE with the ARTAS iX system, and it can really give great natural results. The hairline does not look like unnatural, and it's a random hairline, and patients were all very happy. This, whether they keep their hair longer or keep their hair shorter. Some of these with the blue background are really 6 months after the procedure, and they have great growth. And that's what you get with the ARTAS system, is that you're getting better quality grafts, and the better quality grafts that are being harvested with less trauma are going to grow better. And we see that here. It takes a full year. It can take up to a full year to see the full results of a hair transplant procedure. But even at 6 months, these patients are really happy. They have minimal scarring. They can keep their hair short on the back and sides where the hair was harvested from without anything being noticeable. Another advantage is that they can return to full activity very soon after the procedure. So there's multiple advantages of the FUE, and especially FUE procedure using the robotic technology. And behind me is actually my robot. This is the ARTAS iX system that I use in all my procedures, and I've been extremely happy with what I'm able to do with it, what I'm able to offer for my patients. Once again, my patients come in and they've researched it, they've looked into it, they've Googled it, they know about robotic technology, and they seek out the robotic technology. So a lot of the information that I've discussed with you guys today, I discussed with the patients, and they're really into it and really interested in hearing more about it. We were fortunate in the past year or two to, I was fortunate to be able to take my robot onto the sets of some TV shows. We did the Today Show, the Dr. Oz Show, and Good Day New York on Fox. And we brought this robot to the set and did a simulated procedure on a dummy head. And it was extremely well received. There was so much interest regarding a robot that can do this, a robot that's available in the aesthetic space, and just the robotic technology in general. So that was great, and it was well received, and we were fortunate to be able to do that. And there's a lot of great capabilities to come, and that's what I'm really excited for. So once again, my name is Michael Wolfeld. I'm a plastic surgeon in New York City. There's a lot of information that I have about the system as well on my website, wolfeldhair.com. If you're interested to see the robot working on a dummy head on the Dr. Oz or Today Show or Good Day, you can go to my website. It's on there as well. But the technology is there. The technology is advanced tremendously, and it's robotic technology that can give you an optimal aesthetic result, and that's really what we've been able to achieve. Thank you for joining me and listening to this presentation. And once again, if there's any questions from this, anybody's able to reach out at any time, and I'd be happy to answer. Thank you.